Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. On this week's episode, we're going to be talking all things otoplasty. Ear pinning. That's right, ear pinning. We've touched on this subject in the past, but we've never really devoted a whole episode to it, and it's definitely episode worthy. For anyone who suffers from feeling insecure about their prominent ears, or from anyone who had it done, they'll tell you how important this subject matter is. So what is ear pinning otoplasty and why the hell do we do it? So many reasons why people don't really know about it. It's kind of one of those things that people don't talk about. And for the most part, there are two times in life when you get an otoplasty. Wait, back up. Why are you getting an otoplasty? Figure out what it is. It's having not large ears, meaning your ears are just big. Prominent ears means your ears stick out. So an otoplasty is a surgery in which we pin or push the ears back and make them sit more flush against the head, as opposed to having them be forward where you see them when you're standing in front of someone. An otoplasty is not taking really big ears and making them small. We cannot shrink the size of the ear. The next question is, okay, well, who gets it and when do they get it? So there's two times in life that you get an otoplasty. There is when you were a child, which in most instances is the case. And then the second is as an adult, which is actually not that uncommon anymore now that plastic surgery is much more mainstream. Why would you ever put a little child through some cosmetic surgery? It sounds like what you would do to like a pit bull and like clip his ears and shorten his tail. No, because children get bullied, and talk to any adult, they get bullied like crazy as a small child, because prominent ears are the easiest things to pick out on a child on a school playground. And we actually start doing otoplasty as early as 4 years old. So the ears are essentially fully grown, and the child is now beginning to have a sense of self and image and can start being picked on and will cry and become shy. So we like to, if you're going to do it for a prominent ear as a child, we do it when they're young so that it's done, so to speak, nipped in the bud, and they can grow on and be fine. For those people who wasn't as bad, their parents weren't aware, they never verbalized it, they didn't have the money. For those people, they do it as adults. So wait, why would an adult care? I mean, I understand as a kid, but why the hell? It makes a big difference. So in women, you can speak to many women who would love to wear a high ponytail, but they don't. They never do, because their ears stick out and it's very prominent. And there are many, many men who like to have really short hair, and they end up growing their hair a little longer so it covers the size of the ears again. So believe it or not, for those individuals who suffer from prominent ears, it's a big deal. Okay, so what is the procedure? What exactly are you doing? You're just gluing the ears to the head? No, that's not what we're doing. It's actually kind of a sophisticated procedure. Actually, one that I like a lot because it requires a finesse, and I like finesse surgeries. So there are three key parts to an otoplasty. First thing is, where the hell's the incision? And the thing is, the ear is really well situated. It's hidden. So we make an incision behind the ear in the sulcus. That's where your COVID mask sits, or your back of your glasses sit. So it's hidden behind the ear. Now, when your ears are prominent, it's not hidden at all. But when your ears are put in the correct position, that scar ends up being hidden. We access the entire ear from behind. So there are three parts to it. What makes an ear look prominent? So number one is not everybody, but you know what the helix is. The helix is the actual fold or the rim of your ear. It's bent. Right behind the rim, meaning in front of it, is another fold called the antihelix. That's the other fold. And if you look at your own ear or your loved one's ear, you'll see that there's the rim, and then there's another fold in front of it. For people with prominent ears, many of them don't have that fold. It just doesn't exist. And their ear, they themselves will refer to as look like Dumbo ears. They're just flush. And when they're flush like that, they kind of rotate out a little bit, and the upper outer ear kind of flops out. That's one issue. The second issue is the bowl, called the concha, the bowl of the ear, can be prominent, really large, which then forces the ear out. Like you can't push it against the head, because you go to push the ear in, this like cartilage is in the way and it pushes it out. And the last is that the ear itself, just from birth, is angled and comes out of the head at a really large angle. We call it obtuse, as opposed to just comes from the ear flush. So naturally, when you want to correct the ear, you address these three issues: the lack of the antihelix, the really large concha, and the fact that the angle of the ear is a little bit too obtuse. Does everybody have all three issues? No. But as a surgeon, you would evaluate the ear, and depending on what they need, you would do what? So the area that has no antihelix, the way you create the antihelix, which I think is really sophisticated and cool, is you use sutures, but they are permanent. Permanent sutures, kind of like cables. And when you put in these sutures and you tie the knot, it forces the ear to start to fold. And the tighter you tie the knot, the more it folds and the more it folds and the more dramatic the antihelix becomes. So you can do a little or you can do way too much and then make it look really obvious that it was surgically corrected. If your concha is in excess, we actually cut out part of the concha and take out the bit that's too much. And when your setback is too obtuse, we actually suture the ear against the head and make it a little more tight. These are the three steps, the three critical steps that are done in otoplasty in order to make the ear more flush with the head, excuse me. Now, what's interesting about the ear is that unlike your eyes, your eyebrows, you never look at the ears at the same time. So if there's differences between the ears, it's not that big a deal. You're looking at one ear when you turn your head and then the other ear. The only purpose of the ear is just not to be obvious. So I think the success rate when done correctly is quite high. It really, really makes people happy. What we're gonna do is we're gonna take a really quick break and then we'll come back and then I'm gonna talk to you about what's the recovery and what are the risks. Now, the recovery and the risks are, let me rephrase that. The recovery itself is a little bit annoying because even though the surgery is pretty quick, the recovery is a little bit more tedious. So stay tuned. And when we come back, we'll continue talking about ear pinning. Welcome back to Plastic Surgery Uncensored with Dr. Rady Rahban. So we were chatting about otoplasty ear pinning. And so let's dive into the recovery. So I get my ears pinned, must be quick, I get to go, right? Not exactly. So the pain is not that big, it's minimal. And this is the kicker. So we pin your ears back, okay, based on the way that I described before. And then you kind of get wrapped up like an Eskimo or a Teletubby. We protect your ears. Now think about this for a second. When you sleep, are you paying attention to your ears? You're not. So you're rolling left, right, and center, and you're gonna crush the ear that you just fixed. So we kind of pad them up and then wrap you up like an Eskimo. And then you come in for your 1 week visit. We remove all that. Your ears will be mildly swollen, a little bruised, nothing too terrible. But then this is the key. For most surgeons, they'll have you wear a headband for about a week. And I used to have you wear a headband for a week as well. And the headband is there to keep the ears pinned to your head while the swelling settles. I now am very aggressive about wearing the headband because I want the ears to really heal where I left them. So I actually force my patients to wear the headband for 6 to 8 weeks. Why do I say force? Who the hell wants to wear a headband 24 hours a day, 7 days a week, with the exception of showering, for 6 to 8 weeks? Nobody. But when your ears are fixed and you look amazing, I promise you it'll be well worth it. You can go back to life, do your exercise, do whatever around 6 weeks. And the surgery is relatively quick at 2 to 2.5 hours. And I do all these surgeries under general anesthesia. Some people do them under conscious sedation or twilight or whatever. That's up to them. I like general anesthesia. Why? You come in, I have an amazing anesthesiology team. You go to sleep, you wake up, you go home. Bam, easy breezy. So that's the recovery part. Now, my favorite part of the discussion, which is always the risks. And the reason why it's my favorite part is this is the part you need to be educated about, because we can sell you anything. I mean, we could sell you snake oil, but the key is being knowledgeable. And this is where I think the podcast excels, which is us telling you what you need to be careful of so that you get a great result and not become a statistic, a revision, a catastrophe, something went wrong. So what are the things that can go wrong with otoplasty? Bleeding. The ear bleeds like a stuck pig. It bleeds like stink. And you can get a hematoma. A hematoma is a big deal in the ear. If you think about wrestlers or cauliflower ear, does anyone know what that is? If you don't know what a cauliflower ear or a wrestler's ear is, Google it. It looks awful. Cartilage is really delicate, believe it or not. And when you wrestle, people are smashing you against the mat and punching you in the ear. And then and boxers get it too. And you get blood there, and the blood heals and causes scar tissue and makes the cartilage thicken. So bleeding is really not common, but it's possible. And you have to be very alert and fix it. Infections can happen, but the ear tends not to have a lot of infections. Asymmetry, big time. Any surgery where there are two of them, two breasts, two eyelids, two eyebrows, two ears, is difficult because you need to make both of those structures look great. And then that's right. You need to make them look the same. Now, the ear, you get away with a lot more because, as I said earlier, you're not looking at them simultaneously, but you can have one ear sticking out way more than the other, and that will definitely piss you off. The biggest concern, in my opinion, or the biggest risk is overcorrection. So the answer to the surgery is not just pin the ear back, just smash it against the head and call it a day. Because if that's the case, then you can have your gardener do it. And if you look at your mom's ear, or your dad's ear, or anyone's ear, and you look behind them, the ear is not stuck against the head. The ear actually comes out of the head at an angle. And so when you're looking dead straight at somebody, you can actually see the ear, but you just see a little silhouette of the ear because the ear is expanding as it goes out. So the intricacy of this surgery is bringing the ear back, but not bringing it back so far that it looks ridiculous. And that is very difficult to fix. And the reason why it's a major complication is because when you're not well trained and you don't do a good job, it's easy to overdo something. You can easily make the nose really small. You can easily make the breast reduction really small. It's very hard to make it right. So that's a big deal. And one of the other things is loss of correction. So loss of correction means we do it, it looks great, you love your ear, it's awesome. And over the course of the next 2 months, one or both the ears start to creep slowly back to where they were. Remember, if you're an adult, you've had your ears in whatever position for 20, 30 years, and your ear doesn't really want to stay in, it wants to be out. And that is why I force you to wear the damn headband for 6 to 8 weeks, because I want a crutch or a cast around the ear while it's healing. So to avoid this sort of partial relapse or whatnot. In general, otoplasty is an awesome procedure for those people that are seeking it and have it done and they get a good result. They're very, very happy. And as always with cosmetic surgery, if you don't suffer from the entity being discussed, you can't see the benefit in it. At any rate, that's pretty much your A to Z to know about otoplasty or ear pinning. Hopefully that was at the very least entertaining or informative. And if certainly you're a patient who's considering it, hopefully you found that to be useful. And that wraps up another episode of Plastic Surgery Uncensored. As always, please share, download, and subscribe. And we'll see you next week at yet another interesting episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.